Hello, my dear friends. Today, we're not going to talk about a cavity. We are not going to talk about a root canal. We are going to talk about a very dangerous problem that is a silent enemy in dentistry, that is oral cancer. And this is one of the topics that sometimes as a patients we ignore and we don't know that we have it, but we as a dentist are obligated to check when we do a medical history, when we're dedicated to observe the patient, the mouth of the patient, the habits, and if we don't look for a malformation, we can ignore it, and then the patient can have oral cancer and it can cost their life. The good news is that if it's detected on time and the patient is going to see an oncologist specialist or an oral surgeon, then they can stop the oral cancer and avoid that gets advanced and avoid the death of the patient. Sometimes, as I tell you, cancer doesn't cause any pain, but if it's advanced, the patient is going to lose their life. But there are three causes that are important that you know that are going to cause oral cancer. One of them is tobacco, is the alcohol, and when they are used together, it gets produced the oral cancer. This is still one of the very important causes of oral cancer. And if we are drinking and smoking at the same time, then we are adding a risk to have oral cancer with tobacco and alcohol. Even the masticated tobacco can damage the cells, dry the bone, dry the mouth, and cause dryness of the tissues and cause oral cancer. Now, the excessive alcohol can be the second cause of the oral cancer. One of the important second causes of oral cancer is the papilloma virus. This papilloma virus is now in fashion because we have discovered that the causes are mainly oral sex and the lack of hygiene during this practice. And this virus can cause cancers on the posterior part of the tongue and on the throat, and people that is very young, even if they don't smoke and drink, this can change the tissue and has become an epidemic. And the third cause is that a chronic irritation, like constantly a denture is creating a chronic inflammation of the tissue and is constant and can generate lesions that with time can become malignant. So we need to have too much caution in these three causes that I just tell you. You have to go to your house, look in your mouth, look in the things that you see that are different, take a look every month if you have malformations on the tongue or some type of lesions around the teeth or chronic irritation that is creating in the tongue, sometimes on the tissues or inside the gum, that we have some type of a balloon or a inflammation of that area that it doesn't cause pain. But this can be a cancer inside the gums. I have a patient that I was able to diagnose on time because she told me that she has some kind of a malformation in the back of the molars, and this was one of the most dangerous salivary glands that you can find in the patient that can cause the death of the patient in a few months. So she did an oral exam and thank God she found it. But if you find like an ulcer that is not curing quickly, you have stains, red, white, that it can be a leukoplasia, erythroplasia. This is one of the causes that you have some type of a granulation tissue around in the mouth that is hard or is soft. For example, on the tongue, on the throat, or in a part that is in the posterior part of your tongue, then it's going to your throat, and it can be one of the signs of a cancer. If you feel that your right side of the jaw is getting numb and you cannot even have an easily way to swallow your food, then you have to go immediately to the dentist or to an oral pathologist or an oral surgeon and be sure that you don't have an oral cancer and that is not an advanced cancer and it's not going to cause the death of your patient. So it's very important as a dentist that we look for this kind of a little bit of different malformations in the soft tissue, on the hard tissue, around the gums, around the teeth, and that is not coming, then we can avoid the death of the patient. So I hope you have liked this episode, and if you have any more questions, let us know and follow us on social media.